Hi, my name is Steve Richer. I'm a project officer for corporate nursing in NHS Lothian in Scotland, and my main responsibility is in the implementation of MEG within our organisation. NHS Lothian covers a wide geographical area in Scotland. We have about 27,000 staff and several acute and community hospitals and other types of facility. About 1,000 of our staff have MEG accounts at the moment. A lot of these are senior or deputy charge nurses, but as we roll out further types of audit, this user base will expand significantly. So we did have another piece of software we were using, but this was run by a one-man band company, and he was retiring. He said he wouldn't be able to support us anymore. So at that point, we knew we needed a new solution. We asked in-house to see whether our IT department could develop anything, but then the pandemic hit and their resource was completely occupied with that. So at that point, we looked around the marketplace to see what other off-the-shelf solutions there might be in the market, one of which was MEG. When we lost access to our existing audit data collection system, nurses on the ward had to go back to using paper audits or Excel spreadsheets. There was no one-stop solution which helped people get the big picture or close the loop on any improvements required. And even with the old system, there were compromises which meant that we did need a more modern and fully featured system such as MEG. There are now several audits on MEG, lots and lots of data, which means clinical nurse managers can easily dig into this data, look at the aggregated data or individual ward data, identify easily any areas of concern or areas for improvement. Having the visual dashboard approach is something which was missing before, but it's really, really helpful now and makes things a lot easier to maintain quality. So our approach in Lothian was not to launch every audit straight away. We had a few ready to go live on day one. So we launched a comms plan with an intranet site, banner on the intranet, and we offered some open training dates. So we started with just a few infection control audits, and meanwhile in the background we were developing some more complex audits and testing them, giving them proper test period. The most complicated audit we have launched is one called LACAS, which stands for Lothian Accreditation Care Assurance Standards. And this was very, very complicated for the developers at MEG because we were asking the system to do things that no other institution had asked it to do before. It basically pulls a lot of data from audits which have been done previously, other types of audits, and develops an aggregated accreditation score at the end. So we'd just like to thank the MEG staff for doing a fantastic job on what was a very, very complicated project there. MEG is just really easy to use and understand. It's very intuitive. We did offer some open training dates, as I said, but not that many people were able to attend these. So what we have found is that most users can just figure it out for themselves. We have prepared some guides and videos which do help them along the way. But in terms of understanding how to use it, it's very simple, which is what you want on a busy ward. One thing which was really helpful at the start during the implementation process is we had fortnightly meetings with Meg's team and several people from NHS Lothian, and this kept the project rolling really smoothly and kept everyone knowing what the other side was doing. Meg has given several of us super user access, which means things like creating user accounts, changing audit questions can be done by us. More complicated tasks we do ask the MEG team to get involved in, and they're very, very super responsive, super helpful and super quick, which is really fantastic support. We've been really, really happy with that. I would say think of the output you want at the start when you're considering your project. Imagine your visual dashboard, what information you'd like to be collected and displayed. Perhaps an opportunity to take a fresh approach, not necessarily to copy your existing unwieldy audits, but to make them as frictionless as possible and just think about what information you'd like to collect and be displayed. And certainly the MEG team will support you every step of the way.